Hey there everybody, Christian Brindle here, Medicare Health Plan expert and specialist, and today I want to talk to you about the shingles vaccine, the Shingrix, and how it's going to be covered on your Medicare plan in 2023 and why this is a significant change to how it was covered previously. In the past with Shingrix, it was covered under Medicare Part D benefit, and with most plans around the country, what we were typically finding is the Shingrix vaccine was covered as a Tier 3 medication. Now, if you've been on Medicare for any extent amount of time and you've had any Tier 3s or Tier 4 medications, typically what you find is those are some of the higher end tiers. In the Medicare world, with most plans, what you're finding is whether you have a Medicare Advantage plan that carries Part D prescription drug coverage or whether you have an individual Part D prescription drug plan, you have 5 tiers. Tiers 1 through 5. Tiers 1 and 2 are your generics, 3 and 4 are your brand names, and Tier 5s are your specialty drugs, like very expensive prescriptions. But the higher the tier goes, the more expensive your copayment typically is for that prescription. Now, the Shingrix was typically, in most situations, covered in most markets with most plans as a Tier 3 medication. Now, this was quite strange because oftentimes most vaccines like the flu shot and different things like that were covered as a medical cost, as a preventative cost under Medicare Part B. The Shingrix was something that was not. And so most plans would have anywhere between a $40 to $45 and maybe some situations as high as a $47 or $48 copay for this. But it's very common for Part D prescription drug plans to have a deductible that might apply only to Tier 3 and higher medications. What this means in layman's terms is if you got your single shot and let's say you haven't met your deductible yet. Let's say you have a $200 a year deductible for Tiers 3 and higher on your particular plan. Let's say you only take generics, and what you end up finding, you're responsible for $200 first and then the $45 copay, which makes you pay $245 for the shingles vaccine, where every other vaccine you've gotten over the course of the year has been zero. And so this might come as kind of a shock to a lot of people when they would get their Shingrix vaccination. Well, one thing that's changing that's going to impact this mightily is starting in January 1st of 2023, all vaccines will be covered free under Medicare Advantage or Part D prescription drugs, including the shingles vaccine. No matter your plan, you'll pay no deductible, copay, or other cost for the shingles vaccine. So this is a big, big change. This is a great addition and a great modification that we're seeing to the Medicare program, and it should help people from having those surprise $200, $250, maybe even $300 bills when they would get their shingles vaccine. Anyway, folks, if you found this video helpful and you found it educational and informative, do me a favor. I run an agency called Christian Brindle Insurance Services. We specialize in Medicare plans. We work with a litany of different insurance companies around the country, and we're licensed in 46 states. Drop a like on this video. It helps more people like you who need to know our information find it easier. Make sure to comment your thoughts down below. Do you feel like this change is a good thing, a bad thing? What do you feel about it? Have you ever had to pay for your shingle shot before, and it might have come as a surprise that this might actually be a positive thing going forward? I'd love to have a dialogue with you about it. Make sure to subscribe if you like Medicare information, and feel free to reach out to us. Our phone number is down in the description of this video, to our office. Like I said, we're licensed in 46 states. We're in the annual election period right now. We'd be happy to shop your plan and make sure you're on the best one with no cost, no obligation. Thank you, folks. Have a great day and enjoy the no-cost shingle shot.